Hi, I'm Alok Khorana. I'm a medical oncologist at the Cleveland Clinic with an interest in thrombosis, and I'm here at the American Society of Hematology meeting in 2016. A couple of the abstracts that we're really excited about, one of them is most of them are looking at the use of direct oral anticoagulants. These are drugs that have come onto the market in the last 2 or 3 years and are much more patient-friendly and easier to use than older anticoagulants like low molecular weight heparins and warfarin. The challenge has been with these drugs, they were primarily tested in the non-cancer setting, so in atrial fibrillation or prevention of VTE after orthopedic procedures. Finally, this year, we are starting to see data utilizing these drugs in the cancer setting. And what data has been presented at this meeting and earlier this year all suggests that the drugs are safe to use and they may be effective in preventing VTE. One of the abstracts is from the University of Minnesota, and they're looking at several thousand patients with cancer who have atrial fibrillation and the use of DOACs in those patients. And they found that DOACs were just as safe as warfarin, if not safer, with maybe less risk of bleeding. And they were able to prevent both ischemic stroke and arterial events as well as venous thromboembolism events. That's very encouraging, and it suggests that the ongoing trials of prophylaxis such as Cassini, which uses rivaroxaban, and AVERT, which uses apixaban, which are being run in multiple countries, may have the potential to change risk of VTE in the future in cancer patients. Other abstracts have looked at extended use of rivaroxaban in treatment of VTE. I presented some data looking at rates of recurrent VTE in patients who stayed on rivaroxaban after 3 months and after 6 months. And in both those studies, we found that there was no increased risk of major bleeding, but there was a reduction in the rate of recurrent VTE. And this supports the findings in the clinical trials, but because our data was in the real-world population, we feel that it suggests that this is both beneficial to patients and safe in the outpatient setting. Finally, we looked at rates of major bleeding between cancer patients and non-cancer patients, also with rivaroxaban, in a Department of Defense cohort, and we found that there was no increased risk of major bleeding, and in fact rates of major bleeding in the cancer population were just the same as in the non-cancer population. So taken together, all of these data suggest that direct oral anticoagulants are going to be important for cancer patients in the future. We should support ongoing studies, and we feel that the use of these drugs is both safe and beneficial in this population.